name's Nancy. I'm a nurse. How are you?
Doing well, thank you.
I'm going to be doing an assessment of your hair, skin, and nails today.
Okay.
I'm going to start out by asking you 2 questions. Any history of skin cancer?
None.
Do you lay out in the sun, tan,
No.
go to a tanning booth?
No.
Okay. All right. Well, that's good. When you do go out in the sun, do you wear sunscreen?
I don't.
Oh, okay. All right. So it is important for preventing skin cancer to wear sunscreen when you're out in the sun. All right, so I'm just going to go ahead and move along with looking at your skin. So I'm going to have you put your legs up, and if you want to lay back, if it's more comfortable, that'd be fine. Okay, so I'm looking at your skin color overall, looking at your face and your chest, and what I'm looking for is, do I see anything abnormal like pallor or paleness? Cyanosis, that would be blue, erythema, that's red, or jaundice, which would be yellow. And then I'm inspecting the skin, and I'm also touching the skin of the upper extremities and the lower extremities, checking for temperature. And I see that your skin is warm and dry. And I note that your skin is smooth and thin. That is normal. Skin is thin. The only places where we have thick skin is on the palms of our hands and the soles of our feet. I'm also going to, right here, check for turgor and mobility. When I pinch the skin up, it should move easily. That would be normal mobility, and it should go right back to normal. That would be right back to its normal spot. That would be a normal turgor. So mobility and turgor. Mobility, how easy does it move? Turgor, how easily does it go back into place? Okay, and then I'm also, as I'm looking at the skin, I notice that you have lots of moles on your chest, anteriorly, kind of all different sizes and different shapes, but mostly all the same color, light brown to a darker brown. I don't see anything that is larger than 6 millimeters, so I don't see anything of concern. And then on the legs, I don't see any moles. I do see this one spot right here where you have a little lesion that is healing. You mentioned that was from a bike accident. It looks like there's another small one right here. I do see that the skin looks normal here. I don't see any lesions or anything abnormal all the way down to your feet. And then if you could sit up for a second, let me look at your skin in the back. So again, I'm going to have you stand up and turn around for a second. There we go. So looking at the back, I see a lot of moles on the back, and I see a lot of macula. Macula are freckles. Okay, so there's lots of freckles right up here on the upper shoulders, and I would just document that as numerous light brown macula on the shoulders. And then I would also document numerous small, less than 6 millimeter papules over the anterior and posterior chest. I would document about this mole separately. It is less than 6 millimeters. It's oval in shape, which is symmetrical. It's dark brown and it's raised. So this might be something, Mr. Hoffman, this is right on your back, so it's probably hard to see. So probably if you can have a family member look at that for you every month and just keep an eye on that and make sure that it's not changing. Are you aware of this mole right here?
Yes, I am.
Okay, and has it changed at all over the years?
It does not seem to have.
Okay, all right. So that would be the only one that I would be at all concerned about. Okay, you can have a seat again. And then we're gonna go on to look at your hair. Okay, so I see your hair is a mix of brown and gray. It's smooth. Your hair distribution is symmetrical. You have some very typical male pattern baldness, but that's expected. And I'm looking, what I do is I part the hair, okay, and really look in there for any infestations or any lesions or anything in the hair, which I do not see. Everything looks completely normal, nice and smooth, and clean hair. And then we're going to go on to looking at the nails. So I'm going to look at the nails on your fingers. To start out with, what I'm looking for is that the nail bed should be pink and the nails shape is round. Some people have flat nails this way, flat. Some people have a little bit more rounded. Some of your nails are a little rounded and some are flat. And when I press on the nail bed, it should feel firm. It should not feel spongy. And I also check for the profile sign, which should be 160 degrees or less, which I see that yours is 160 degrees, which is normal. And I'm going to do the same on this hand as well. I'm looking at the nail beds. They are pink. Nails are rounded. Your profile sign is less than 160 degrees. And then I'm going to do the same on your feet. I'm going to lift your feet up here again. All right, so I'm looking at your toenails. The beds of the toenails are pink. Your toenails are flat. We usually just check the profile sign on the fingernails. So I see one nail here is a little bit yellow and thicker. That can happen with aging, that the nails sometimes get thicker, or it can also happen with a fungal infection of the nail. So, Mr. Hoffman, before we finish with assessment of hair, skin, and nails, I want to just give you a little tool that you can use for assessing your skin for any risk of skin cancer. So we use an acronym. It's called ABCD to help you remember what to look for. So when you're looking at that mole on your back or any other moles that you may see, the first letter is A. A stands for asymmetry. So if it looks asymmetrical, meaning that it's irregular and the two sides do not match, that would be a concern. Okay, B is for borders. If the borders are not smooth and regular, they're irregular borders, that would be a concern. C is for color. What we're looking for is variable color within the same mole. Like if you see a mole that's got brown and black and blue and red all in the same mole, that would be a concern. And then the last thing is D, or diameter. So if it's more than 1/2 of an inch or about the size of an eraser of a pencil, that would be a concern. So that's how it helps you to remember how to look at your moles and when to contact your physician for follow-up. So use A, B, C, D. Understand?
I do, thank you.
Any questions?
None at this time.
Okay, thank you. That concludes our assessment of the hair, skin, and nails.
Come in.
I'm washing my hands. Hi, Mr. Hoffman. How are you?
I'm doing well, thank you.
My name is Nancy. I'm a nurse. I'm going to be doing an assessment of your belly.
Okay.
All right. I'm going to start out by asking you 2 questions. Are you over 50?
Yes, I am.
And have you had a colonoscopy screening for cancer?
Yes, I have.
Oh, good. That's an important preventative care measure to take. And do you have any history of problems with your gut or your abdomen or your stomach, ulcers?
No, I don't.
All right. Okay, so I'm going to start by looking at your belly. So I'm going to look from here, and I'm looking at the contour, which is the fancy word for shape. And your abdomen is a little rounded. And then I'm going to come down here from the foot of the bed and look for symmetry. Both sides should be the same, which they are. And then I'm going to come back here and I'm going to look at your umbilicus, or commonly known as the belly button. And looking for any lesions or any problems or any skin discolorations, or many young people have a piercing here, so you would want to note that. And then I'm going to look at the abdomen overall for skin color and any lesions. This is a common place for moles. And so we do look at moles as part of skin assessment, but also part of the abdomen, that you would be looking at the skin for anything abnormal. And then also I'm looking for movement. I should see normal respiratory movement of the abdomen, which I do see. And also right here in the epigastric area, many times you can see the pulsations of the aorta. That is a normal finding and is seen commonly. Some people you can see it, some people not. Usually in thin people it's visible. And I do see the aortic pulsations here, and I see the respiratory movement, that's normal. I do not see any waves of peristalsis. It's uncommon to see, but you do want to look for that. And then I'm going to move on to auscultation. When we do assessment of the abdomen, we do auscultation after inspection. prior to palpation. I use the diaphragm of my stethoscope, and I make sure to listen in all 4 quadrants. And what I'm listening for is vowel sounds. Vowel sounds are kind of tinkly sounding. So I'm listening in all 4 quadrants. Usually you go around like a clock. You can start in any quadrant that you want. And when you listen to vowel sounds, you would need to determine, are the vowel sounds normal, or are they hypoactive or hyperactive? This is something that you will learn as you listen to more abdomens and you train your ears to hear vowel sounds. It's very difficult to count vowel sounds and to have a very specific number that equals hyperactive as opposed to hypoactive. So this will come with more experience. Then we're going to move on to palpation. So we start with light palpation across the whole abdomen. You want to cover the whole abdomen. And usually, again, you go in a clockwise method, but you want to make sure that you cover the whole abdomen. So I'm going to start by just pressing down about 1 inch and using a rotary motion and all over the whole abdomen. And Mr. Hoffman, let me know if there's anything that feels tender. And is there any area of your abdomen right now that's bothering you that feels tender or painful?
No, not at all.
All right. So if there was an area that was tender, you would want to save that for last. If you palpate the tender area first, you're going to be done with your assessment because the patient will be not happy with you. Okay. So now I'm going to palpate your abdomen a little. I'm going to press a little bit more this time, so you're going to feel a little bit more. So now I'm going to press in about 5 to 8 centimeters. So sometimes this can be difficult if people kind of tense up the abdominal muscles as you're doing this. Maybe it feels a little uncomfortable or they're a little bit ticklish. So you want to try to help your patient to relax while you're doing this. All right, so you just want to make sure you cover the whole abdomen. All right, good. Well, wonderful. Any questions for me?
No, again, I felt no pain on that second time.
Okay, good. All right, well, that concludes the assessment of the abdomen. I'm washing my hands. Hi, Mr. Hoffman. How are you?
Doing well, thank
Do
you.
you remember me?
Yes, I do. Yes, I do.
I'm Nancy I'm a nurse from Harper College.
Oh, yes, yes. I've heard of you.
Okay, so today what I'd like to do is an assessment of your eyes, ears, nose, throat, and mouth.
Very good, let's do it.
Okay, so I'm going to start with 2 questions. One, I see that you're wearing eyeglasses. Do you have problems with distance vision or with near vision?
I have problems with near vision.
With near vision, but you can see distance fine without your glasses.
I have problems with both. I need
With
glasses.
both. So you're wearing bifocals?
I am wearing bifocals.
Okay, all right. And any problems with your mouth or throat, like frequent sore throats, or
No?
did you ever have your tonsils taken out?
No.
You still have your tonsils?
Yes, sir.
Okay, all right. So we're going to start by doing a visual acuity test. That means we're going to check your distance vision by using what's called the Snellen eye chart. So I'm going to have you step over here. Okay, so you are positioned 20 feet from the Snellen eye chart. So cover your left eye. And then on the Snellen chart, I'd like you to read the smallest line that you can read.
Let's go with line number 6. E, D, F, C, Z, P.
Okay, and then can you try line number 7?
F, E, I, O, P, Z, D.
Okay, good. So now cover your right eye. And then read the smallest line you can read.
I think that's gonna be line number 8.
Okay? Go ahead.
D, B, F, P, O, Z, E, O.
Okay, and then can you read line number 7?
F, E, L, O, P, Z, V.
Okay, good, thank you. Okay, so with the right eye, you were able to read line number 7. You only missed one letter, so you really were able to read most of that. So your vision in your right eye is 20, 25. And what that means is that at 20 feet, you are reading what the normal eye can read at 25 feet. Then with your left eye, you tried line number 8, but you missed about 3 letters with that one. So you really couldn't read line number 8. You were able to read line number 7. And so with your left eye, again, your vision is 20, 25. That means that you are reading at 20 feet what the normal eye can read at 25 feet. Okay, and that is using the Snellen eye chart. All right, thank you. Let's come have a seat on the exam table. Okay, so we're going to continue the examination of the eyes. Can you look up a little bit? Just your eyes, look up. All right, I'm looking at the conjunctiva. It should be moist and pink, which it is, and I'm looking at the sclera, which is china white and moist. I'm looking at the symmetry of the eyebrows and the eyelids, and I'm noticing that the space between the upper lid and the lower lid is symmetrical on both sides. So I see that the eyes are symmetrical. And then I am going to have you follow this pen with your eyes keeping your head still. And I'm going to have the pen move into the cardinal positions of gaze, the 6 cardinal positions of gaze. So just follow with your eyes. The eyes should move symmetrically. Follow the pen. Okay. So conjugate movement, meaning the eyes are moving together nice and smoothly, is normal. And then I'm going to move this towards your nose. Just follow it in. Follow it in, follow it in. Okay, good. Let's try that again. I want you to keep your eyes on this, both eyes. Okay, good. So, and that is testing cranial nerves number 3, 4, and 6. Looking at the extraocular movements, or sometimes you hear it abbreviated EOM, extraocular movements. Now I'm also going to look at the pupils of the eyes, so look straight at me, and I'm going to shine a light into the pupil. Okay, and I see that the pupil responds by constricting, and the other pupil responds by constricting. And I also am looking at the pupils at rest. They are equal in size and round, and the irises are brown and equal and round. And the pupil responses I would document as perla, P-E-R-R-L-A. The pupils are equal, round, and reactive to light and accommodation. Okay, so that's everything with the eyes. Then we're going to move on to the ears. We are going to be just looking at the ears. The ears are symmetrical. They're in the correct location on the head. If I was to draw an imaginary line from here out to here, the pinna should be there. It should not be below there. And I'm going to palpate the ears. I'm just touching your ears. Any pain?
No.
Or tenderness with that? And I'm looking at the skin. I'm looking behind the ears. Sometimes our patients in the hospital, they get pressure sores from wearing oxygen here, so it's a good place to make sure that you look and assess. And then I'm going to assess cranial nerve number 8. That is your hearing. And I'm going to whisper something in your ear, and then I'm going to have you repeat it to me.
White shirt. White socks.
And you're a fan of the White Sox?
Fan of the Cubs. The color of your shirt jacket here.
Okay. All right, so that means that cranial nerve, the acoustic nerve is intact. And then I'm going to assess the nose. I first see that the nose is fairly symmetrical. in your book, it describes the nose as a triangular shaped organ that is on the front of the face. I think that's an interesting explanation of the nose. I am going to palpate. Any pain with that? Tenderness?
No.
All right. And I'm going to look at the septum. It looks like your septum is in the center where it's supposed to be. I see each of the nares is equal. Can you plug one of the nares and breathe in and out? Any trouble breathing? And the other side? Any trouble breathing? Okay, so both nares are patent. Okay, so that's all for the nose. And then moving on to the mouth. All right, so first with the mouth, I'm going to look at the lips. And I see that his lips are pink and moist. I don't see any lesions or cracking on the lips. And then I'm going to look inside the mouth, if you can open. I first am looking at the teeth. His teeth are white. I do not see any missing teeth. I see the gums are pink and they look tight around the teeth. I don't see any gum disease or inflammation or redness. I notice there's some fillings on the teeth, but I do not see any missing teeth or malpositioned teeth or teeth that are rotten. And then I'm going to look inside. I'm looking at the inside of the cheeks. That's the buccal mucosa on each side. Okay, it should be pink and shiny with no lesions. I'm looking at the tongue. Can you stick your tongue out? So there's the ventral surface of the tongue. It's pink and rough. Can you lift your tongue up? And I look at the dorsal part of the tongue. It's pink and shiny, and I see the veins there. And I look right down here into the bottom of the mouth, and that's pink and shiny as well. And then I look at the back. Okay, I'm just going to touch your tongue here. Don't put the depressor too far back in the tongue. You'll gag the person. So I look all the way to the back at the uvula. It's pink. I look at the tonsils. They're not enlarged. I look at the back of the throat. So the last thing I'm going to check in the mouth is for you to say, ah. And I see that the uvula and the soft palate rise, and that is testing cranial nerves number 9 and 10, and they are intact. That concludes the assessment.
Come in.
Washing my hands. Hi, Mr. Hoffman. How are you?
Doing well, thank you.
My name's Nancy. Next time I come in, I'm going to ask you my name.
Okay, I'll remember.
All right. How are you today?
Fine, thank you. And yourself?
I'm good.
Good.
I'm good. So I am here to do an assessment of your head, face, and neck. All right?
Okay.
I'm going to start by asking a couple of questions. Do you smoke or chew tobacco?
No, I do.
Have you ever chewed tobacco?
Never.
Never, okay. Any problems with your mouth or your face that you're aware of?
No.
Any
no.
problems with your thyroid gland,
No.
hyperthyroidism?
No.
Okay, all right, so we're just gonna proceed then, and I'm gonna start out by looking at your head and your face. So I'm looking at the shape and size of your head, which is appropriate for your size of person, and we call that normocephalic. And then I'm going to palpate your whole scalp here, your head, and what I'm checking for is any lumps, bumps, protrusions, indentations. Anything hurt back here? You get kind of a little massage. Maybe that feels good.
Yes. No, nothing hurts at all.
All right, I see nothing abnormal. And so while I'm palpating, I'm going to put my hands right here, and I'm going to ask you to open and close your mouth real big. Okay, and close the temporomandibular joint, and I'm checking for any clicking or crepitus or any pain. Any pain with that?
None.
All right. And then I'm moving on to inspecting your face, and I'm looking for symmetry of the face. So when I'm looking for symmetry, I'm looking at the eyebrows, the eyes, the labial folds here, okay, and the sides of the mouth. It should all be symmetrical. If there was one side of the face that was drooping, it would indicate possibly a stroke or possibly a problem with cranial nerve number 7 or Bell's palsy. So we're looking for any swelling of the parotid glands on the sides of the cheeks, and then put your chin up for any swelling right here of the salivary glands and any swelling here at the base of the neck for the thyroid gland. All right, that's good. We're going to assess the lymph nodes of the neck. So the lymph nodes of the neck, all 11 sets, you want to check them at the same time with the pads of the fingers using a circular motion. So here are the pre-auricular, the post-auricular right behind the ear. Okay, can you turn your head towards me a little bit? And then the occipital right back here on the occipital bone on both sides. The submental right under the chin. The submandibular, okay, here's your jawbone, the mandibular right under there. The jugulodigastric right at this corner of the bone here, jugulodigastric. The superficial cervical, and then the deep cervical chain all the way down the neck. So you notice I'm using 3 fingers with the pads of the fingers and using a circular motion. And then the posterior cervical all the way back here, posterior. So here's the cervical spine, and then right here is the posterior cervical. And then the last set are the subclavicular. So here are the collarbones, and you want to put your fingers right in here, and can you shrug your shoulders up? There you go, right into that hollow right there is where you would feel those. All right, you can relax now. And lymph nodes, you should not feel at all. That would be a normal finding. If you do feel a lymph node, then you would have to assess the location, the size, the consistency, the shape of those lymph nodes. And then you would have to investigate further as to why there are enlarged lymph nodes. But it would be normal to not feel them at all. Or if you did feel it, it would be very small and soft. And then you can look straight at me, and we're going to continue with assessment of your range of motion of your neck. So can you put your chin up, and then put your chin down to your chest, and then turn side to side. There you go. And then put your ear to shoulder, and then your ear to your other shoulder. All right, good. So your range of motion on your neck is normal. Now we're going to check the function of cranial nerve number 11. So can you shrug your shoulders? No, shrug up. Shrug up. There you go, against my hands. All right, good. Relax. And turn your head face against my hand. Turn it against my hand. There you go. Turn against my hand. All right, good. That's assessing cranial nerve number 11, which is functioning normally. That concludes the assessment for head, face, and neck. All right, knock, knock. I'm washing my hands. Hello, Mr. Hoffman. How are you today?
Doing well, thank you.
My name is Nancy. I'm going to be doing an assessment of your heart and the vessels in your neck today. So I'm going to start out by asking 2 questions. Do you have any history of heart disease?
I do not.
Have you ever had a heart attack or a procedure where they put in a stent?
No, I haven't.
Heart failure?
None.
Okay.
No.
Do you ever experience any chest pain?
I do not.
Okay, good, good. All right, so we're going to start out by looking at the veins in your neck, and for that I need you to lay down at a 45-degree angle in a supine position, which means flat. And I'm going to ask you to turn your head a little bit to the left, and I'm looking at the vein right here in your neck, and it should be flat. That would be normal. Some people you could see the vein, especially if the skin tone is very light. Other people you cannot see it at all, but there should be a notice of it that it's flat. If you see the vein itself is large or bulging, that'd be an indication of an increase in pressure there, which would be abnormal. All right, that's good. I'm going to have you sit back up. And I'm going to palpate your carotid pulse. So I'm putting my fingers right next to the trachea at about midway up the neck. And what I am feeling for is the strength of the pulse. A normal strength would be 2+. I am also feeling for the upstroke. It should be nice and smooth and strong. And then I'm going to also do the same thing on the other side. And then I feel that this pulse is 2+ and the upstroke is smooth and strong. Then I'm going to listen to the carotid arteries. I'm listening for a bruit, which is a swishing sound, and I'm going to listen with the bell of my stethoscope, which is the part of the stethoscope that will hear a low-pitched sound. So I place my stethoscope about halfway up the neck, and you take a big breath in and out and hold. And I should just hear the pulse. I should not hear any swishing. And breathe. And take a breath in and out and hold. And I hear the pulse, you can breathe, but I don't hear any swishing. Then I'm going to move down to the chest. I'm looking at the precordium. The precordium is the part of the chest that overlies the heart. And I'm looking to see if I see any pulsations or any movement there, which I only see normal respiratory movement. And then I'm going to palpate the point of maximal impulse, which is at the mid-clavicular line and the 5th intercostal space. So it's going to be, if you put your fingers right here on the ribs, feel in between the ribs, and then you'll feel that pulse. All right, and then I'm going to move on to auscultating the heart. So you start by finding the 2nd intercostal space. So you can either count down from the clavicle, okay, there's space 1 and there's space 2, or you can find the angle of Louis. This is the part of the sternum that protrudes a little bit, and right across from there is the 2nd intercostal space. So I'm going to start by listening with the diaphragm. So make sure that you have your stethoscope set up the right way. Start in the aortic area. Just have the person breathe normal. And I'm listening for the S1 and the S2, the lub-dub. And I'm listening for any clicks or extra sounds or murmurs. Okay, that's the aortic. Right across from that, 2nd intercostal space to the left of the sternum is the pulmonic area. And then as we move down, I'm going to listen to the left at the 5th just right next to the sternal border. And then finally at the mid-clavicular line, the 5th intercostal space, the mitral area. So I heard S1, S2, the lub-dub. I did not hear any clicks or extra heart sounds, and I did not hear any murmurs. Now I'm going to do the same thing with the bell of the stethoscope. So 2nd intercostal space to the right of the sternum, the aortic area. Then to the left of the sternum in the 2nd intercostal space, the pulmonic area. Okay, right next to the sternum, the 5th intercostal space, the tricuspid area. And then finally, the mid-clavicular line, 5th intercostal space, the mitral area. And I heard S1, S2. I did not hear any extra heart sounds, and I did not hear any murmurs. And so that concludes the assessment of the neck vessels and the heart.
Come in.
I'm washing my hands. Hi, Mr. Hoffman.
Hello.
My name is Nancy. I'm a nurse from Harper College.
Oh, nice to meet you.
How are you today?
Doing very well, thank you.
Good. We're going to be doing an assessment of your musculoskeletal system.
Sounds good.
So that's your muscles and your joints.
Okay.
Any history of joint disease? Arthritis?
My mom had arthritis, and my sister has arthritis.
Oh, really?
Yeah.
Is it rheumatoid arthritis, do you know, or is it osteoarthritis?
Well, I think with my sister, it's more rheumatoid.
Okay.
Yeah.
And how about you? Do you have any arthritis?
No, there's no detection of it.
Okay, all right. Any other problems with your joints or muscles or pain limited movement that we should know about?
No, not that I know of.
All right, so we're going to start like in going a head to toe fashion.
Okay.
So I'm going to start with your temporomandibular joint, and I would like you to open your mouth and then kind of stick your chin out and in and side to side. All right, and what I am palpating for is any clicking or crepitation. Do you feel any clicking or anything abnormal with that?
No.
Any pain with doing that?
No.
All right. So for each joint, I'm inspecting, looking to see if I see anything abnormal redness, swelling, masses, and I'm palpating for anything abnormal like clicking or crepitus. And then I'm looking, some of the joints we check for just movement, and some we check for movement and for strength. So I do that for each set of joints. So next we're going to assess your spinal, your cerebral spine. So if you could actually stand up for me and turn around. And then just put your chin to your chest for me for a second. And I'm just going to palpate the spinal processes in the neck all the way down to the 1C7, which is very prominent. It's very easy to know. And then I can feel that this is straight. All right, good. You can have a seat again. And then I want to check range of motion of your neck. So can you put your chin to your chest and look back at the ceiling, look up at the ceiling, and then turn your head side to side, and put your ear to your shoulder, and your ear to your shoulder. All right, and I'm going to test strength. So can you turn against my hand? Good, and turn against my hand. Good, fantastic. So that's normal range of motion and strength for your neck. So next, moving down to the shoulders, I'm going to have you stand up for this. Have you stand right here. So for your shoulder assessment, I want you to go sideways like this, lift your hands all the way up and put them behind your head. Okay, good, and all the way down. All right, and then I want you to swing them this way, all the way up, and then all the way back, and behind your back. Good. All right, and relax. And then lift your shoulders up against my hands. Good, that feels nice and strong. Any problems with your shoulders?
No.
And I'm palpating for anything abnormal, any pain or tenderness with that.
No.
And then I'm going to move down and I'm going to palpate the elbows. I do not see anything abnormal here. And then I'm going to have you bend your elbows up and put them down straight. And then hold them out like this and turn over again. All right, I'm going to check the strength of your elbows. Pull towards yourself. Pull hard. Okay, good. And then pull hard with this one. Good. All right, so your range of motion and your strength in your elbows is normal. Now I'm going to have you put your hands out like this. And I want you to put your wrists down and then your wrists back up. And spread your fingers apart. Put your fingers back together, and then put your hands out straight, and just your fingers down and up. All right, and then put your hands over, and bend your fingers. And I'm just checking the strength of your fingers. Good. And I'm going to do over here too. I'm checking strength of your fingers. Good. And then I'm also going to palpate. This is very important with palpating the wrist and the hand. There are a tremendous number of bones here. So you want to really do a good job of palpating all of these joints, all the way down the fingers. I do not feel anything enlarged or abnormal, any pain with that?
No.
Any pain with any of your, do you do a lot of typing at your work?
Use the computer quite often, yes.
Any difficulty with your wrists or your fingers with that?
No.
Okay. Relax, just relax. I'm just checking. Okay. All right, good. Let's have you have a seat up here, and we're going to move on to your hips. And I am going to have you lay back, and we'll put your feet up. And then what I want you to do first is I'm going to just palpate here on the sides where your hips are. Any pain with that?
No.
Any problems with your hips?
No.
Okay, so with this leg, I want you to move it out this way as far as you can. There you go, and then back in. And then I want you to lift it up and down. And then I want you to bend at the knee and lift it up as far as you can. Okay, and come in. And then also come out. Good, and down. And then I want you to move your leg out against my hands. Push against my hands, good. And then pull in against my hands. Okay, good. All right, same thing with this leg. Move it out as far as you can. And back in. Good, and up as far as you can. And down. And then bend your knee. And come up. And come in. and out as far as you can. Okay, good, and down. And then pull your leg out as far against my hands. Good, and push in. Okay, good. All right, I'm going to actually skip the knees for right now, and I'm going to move down to your feet because you have your feet up here where I can see them. And I'm going to palpate again with the feet and the ankles. There are a lot of bones in the feet and ankles, so you want to do a good job of palpating all those little bones in the feet, all the way down to the toes. Same thing, both feet, make sure that you palpate all those bones. All right, and then can you push against my hands? Good, and pull up against my hands. All right, good. And then I want you to put your toes together. Here, can you put your toes together like that? Good, and can you put them back out? Out like this. And then can you put your feet together like this? And can you pull them out? Can you put them out this way at all? Like this? Okay. All right. Let's have you sit up. And then we're actually going to go back to your knees at this point, and I'm going to palpate your knees. This tends to be a problem area for people sometimes. Any problems with your knees?
No.
Any pain when you walk?
No.
Do you do some walking or bike riding?
Well, sometimes when I'm bike riding, I'll hear a little bit of, almost sounds a little bit like cartilage, but you know.
Like a click?
But like a little click, but I don't feel any.
You just hear the click?
Just hear a click once in a while. Yeah.
All right.
But not all the time.
Okay, can you scoot back a little? No, don't lay down. I just want you to scoot your bottom back a little bit. Not quite that much. There you go, that's good. Okay, so, all right, can you straighten your legs out? And can you bend them? All right, so push against my hands. Good, and pull against my hands. Good, push against my hands and pull. All right, good. Okay, let's stand up on the side. All right, so right here, I want you to stand right here, but put your hand there. Well, you can put your other hand there. There you go. Okay, so put your leg out straight as it'll go, and then bend your knee up as far as it'll bend. Okay, and then do the same with this one. And bend as best as it will bend. Okay, good. Stand up, and then turn around. I'm going to be looking at your spine, and can you take this off for a second? So I'm palpating all the spinous processes all the way down the back. All the way down, all the way down. Okay, and then after palpating the spine, or before, it doesn't matter which order that you do it in, when looking for the straightness of the spine, we're looking for symmetry of the shoulders, the scapula, the hips, and the gluteal folds. And then we are also, can you bend over and touch your feet? When he bends over, we're looking for still symmetry of the shoulders and scapula, and we should see a C curve. Okay, so the spine should be curved like this during that bending over. And then can you stand back up, please? And then when we're looking at the spine from the side, what we are looking at is that the thoracic spine should have that convex curvature, and then the lumbar should have the concave curvature. So you see you have a curve and another curve, and that's a normal curve of the spine. So I'm also going to check range of motion of the spine. So can you put your hands on your hips and bend side to side? Side to side, all right. And then without moving your hips, can you turn this way and this way? Okay, without moving your hips. Turn that way. Okay, and the other way. All right, good. Okay. And I think we've checked out all your muscles and your joints. They all seem to be in good shape.
They feel good.
All right, so that concludes the musculoskeletal assessment.
Come on in.
Washing my hands. Hi, Mr. Hoffman. I'm Nancy. I'm a nurse from Harper College. How are you?
Doing very well, thank you.
Good. I'm here today to do a neurological assessment.
Okay.
And I'm going to start out the assessment by asking you 2 questions.
Yes.
Have you ever had a stroke?
No.
Okay, good, good. And do you have any other problems with your coordination or with your brain that you're aware of?
No.
Ever have meningitis or MS?
No.
All right, good. Okay, that's good to know. So as we do this, I'm going to start by checking all of your cranial nerves, and then we're going to check your coordination, and then we're going to check sensation, and then at the end we're going to do some deep tendon reflexes.
Okay.
So we'll start out by just talking with you, and we're doing what's called a mental status assessment.
Okay.
So I'm first off noticing your behavior, you're awake and alert and cooperative and responding well. And then I'm also noticing your cognition. So I'm going to ask you some kind of silly questions.
Okay.
So can you tell me what month it is?
This is the month of August.
Okay, that's correct. And can you tell me who your favorite president is?
He's dead, but it was President Ronald Reagan.
Now, I happen to know the answer to this question, so I know that's correct, but who's the current president?
Ooh, that's a tough one. Obama.
Obama is the current president, exactly. And can you tell me who I am?
Yes, Nancy Haber-Richter.
Okay, good. So he is oriented to person, place, and time. And tell me why you're here today.
Well, I'm here today to be checked out, and we're doing videos for the assessment courses at Harper.
Okay, so and he's also aware of the situation. So he's oriented times 4, person, place, time, and situation. And I am also noticing that his dress is appropriate, his affect is appropriate, his facial expression is all appropriate for the situation. I also need to screen him for depression and suicidal thoughts. This is a screening that's done at every healthcare encounter today. It's required by the state of Illinois because suicide is causes a high rate of death here in our state. So, sir, have you ever been so blue that you felt like hurting yourself?
No.
Have you felt depressed or unhappy lately over the
No.
past 2 weeks? Like
No.
normal activities are not fun?
No, I've been having fun.
Okay, all right, so at that point I can stop my assessment. If he answered yes to any of those questions, then I would probe further with more questions about that. So, but he answered no for the first screening, and then we're done with that. All right, so we're going to move on for the cranial nerves, and we're going to start with cranial nerve number 2, and that is to your visual acuity. So we checked your visual acuity today, and we would check it for this assessment as well using the Snell and Art eye chart. Standing 20 feet away, we would check both your right and your left eye, and your vision was 20/25 in both eyes. And continuing on with cranial nerve number 2, we would do a confrontation test. Can you stand up? And using this card, can you place this over your left eye? And then I will place this over my eye, and tell me when you see my fingers.
I see them. Yes. Yes. Yes.
Okay, and then switch. Look straight at me, and tell me when you see my fingers.
Yes. 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 Yes.
Okay, good. So your peripheral vision is intact. That's cranial nerve number 2. Have a seat. Now we're going to check cranial nerves number 3, 4, and 6. Can you take your glasses off? You can just hold on to me for a second. And I want you to follow this pen in the 6 cardinal positions of gaze, keeping your head straight. And I see conjugate movement of both eyes together in the 6 cardinal positions of gaze. All right, and just follow this. I'm going to bring it in towards your nose. Good, and I see good accommodation. And then I'm going to look in your pupils. I'm going to shine a light in. And I see that the pupils, both of them, respond to light by constricting. And I would document that as Perla. Pupils are equal, round, reactive to light, and accommodation. That is cranial nerves number 3, 4, and 6. And then moving on to cranial nerve number 5. Cranial nerve number 5 is facial, where we are going to look at some movement of your face. So can you smile and frown and show your teeth like, and I'm just going to check the muscles here, so it'll hurt your teeth. And I can feel those muscles get nice and tight, they're relaxed. And then also there is a sensory portion to this cranial nerve, so can you close your eyes? Tell me when you feel the cotton wisp. Say no.
No. No. No. No.
Wonderful. All right, you can open your eyes again. Moving on to cranial nerve numbers 6 we already did, so we're going to move on to cranial nerve number 7. And can you lift your eyebrows up and down, and then smile and frown, and then squint your eyes closed real tight, and then open them. All right, I'm looking for symmetry of the face. And remember, with this cranial nerve damage is the Bell's palsy, where you would see drooping of one side of the face, or you might see that with a stroke. So that's cranial nerve number 7. Cranial nerve number 8 is the acoustic. I'm going to whisper something in your ear. I want you to repeat it.
Green wall. The Cubs are going to win.
All right, so his acoustic nerve is intact. You can put your glasses back on. So that was cranial nerve number 8. And then moving on for cranial nerve number 9 and 10. Can you open your mouth really wide and say, ah? Wonderful. And I see his uvula goes up and the soft palate goes up, and that indicates that cranial nerve number 9 and 10 is intact. And then cranial nerve number 11, can you turn against my hand? And turn against my hand, and shrug up against my hand. Good, and that is cranial nerve number 11 is intact. And then cranial nerve number 12, can you stick your tongue out? And the tongue should be in the midline, which it is. So now we're going to check muscle strength. So we'll start with the upper extremities. Can you please hold your hands out like this? And we would do that for a count of 10. And then can you squeeze my fingers? Squeeze as hard as you can. Squeeze really hard. Hard as you can. You're not going to hurt me. All right, good. Okay. So the reason that we check strength in this manner for a neurological assessment is that this arm lift is part of the NIH stroke scale that's used across the nation for our assessment of stroke. And doing the finger squeeze is an easy way to check assessment of strength of the upper extremities. If you give 2 fingers, the person can squeeze as hard as they want, they're not going to hurt you. If you give your whole hand or you give 3 fingers, you may come back with your fingers like that, which is usually not very pleasant. And then for the lower extremities, I'll have you lay back for a minute. This is an easy test to do. You probably want to lay back. And I want you to lift this leg up off the bed. And we do that for a count of 5. 1, 2, 3, 4, 5. Good. And then lift this one up again to a count of 5. 1, 2, 3, 4, 5. And relax. Again, that is part of the NIH stroke scale. That's why we use that method. And then if you could press down against my hands and pull up against my hands, that also tests strength of the lower extremities. Okay, so from there, we're going to do some tests of your coordination. So can you do this a finger? Touch each finger as quickly as you can. And then do it with the other hand. All right, good. And now touch your nose, and then touch my finger. Go as quickly as you can. All right, that's good. One caution while you're doing this is that when your client has their finger to the nose, okay, at that time you can move it, but don't, as they start for your finger, don't move it right at that time. All right, that's not a fair test then. So you can move it while the finger's there, but then hold still as soon as they start coming towards your finger. So we're going to check coordination of the lower extremities too. So can you take your shin and your heel, just run it down your shin. And then do it on this other side. Just run it right straight down. All right. And then can you stand up for a moment? We're going to do the Romberg's test. Put your feet together. and put your hands at your, stand up straight, put your hands at your side, put your hands at your side, and close your eyes. And we would count to 20 seconds, and he should be able to maintain this standing straight and still without falling over. Make sure you're here just in case a person does start to lose balance so they don't get hurt. So 1, 10, 11, 20. Very good. You can open your eyes, and then can you walk a couple steps towards that outlet there? Just like about 3 or 4 steps, just normal. And then come back and walk heel to toe. Heel to toe, like this. You can relax your arms. There you go. Okay, good. Fantastic. So your coordination is intact. And then we're going to check the sensory system. So the first thing that we're going to do is check your sharp, dull discrimination. So you start this by having your eyes open and explaining this is sharp and this is dull. You can use a paper clip that you've opened up. You can also use a cotton swab to do this, whatever you're comfortable with. So close your eyes, and then you're going to tell me whether you feel sharp or dull. I'm going to do this all over.
Dull. Sharp. Dull. Sharp. 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 That was dull. Sharp.
Do not draw blood when you're doing this.
Sharp. 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 Dull. 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 Sharp. Dull.
All right, you can open your eyes. And then, again, we're going to check your light sensation. I'm just going to use a cotton ball, and I just want you to say now when you feel that.
Okay.
So close your eyes and say now when you feel the cotton ball.
Now. 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 Now.
All right, good. And then last thing, eyes closed, and hold out your hand and tell me what's in your hand. You can feel it with your hand. Tell me what's in your hand.
It's a coin.
Okay, good. You can open your eyes then. All right, so that's all for our testing of sensation. Now we're going to move on to the deep tendon reflexes. So I'm going to start this by having you just relax your arm up here. All right, I want you to be really, really relaxed for this to work. And you can talk to Amy over there while you're doing this. I have, the way I'm going to do this is have him flex a little bit so I can find that tendon and then have him relax. You really have to be relaxed or this will not work. You also have to hold pressure on the tendon pretty firmly. You can see my thumb is on there pretty firm. Use the pointy part of the reflex hammer and you have to give it a good whack. And I could feel his tendon moving, but what I'm looking for is for his fingers to move, which I did not see. There we go, now we saw a little movement there. Okay, and then we would do the same thing on the other side. You put your arm up here. Again, I'm going to have him flex so that I can feel where that tendon is. I'm going to hold it pretty firmly. Now, I have very poor aim to do it with my other hand, but if you can hit your thumb with your left hand, that would be lovely. I'm not too good at that. Okay, so relax your hand. Talk to Amy over there.
Hello, Amy.
Hello.
Hold it firmly. Oops, I didn't do so well at that. And then what I'm looking for, there we go, is for those fingers to move. So that one tends to be a little bit stubborn sometimes. When you're trying to do that, it's important for the person to be relaxed. And then we're going to move on to the patellar reflex. Okay, so you're going to feel where that kneecap is, and then right below there is where you're going to hit. And you want the person to be really relaxed. When you hit, you don't want to hit like this. You want to hit loosely, like that. When you hit, it bounces off. All right, so you should be able to get a nice little kick from doing that, which doesn't seem to be working well with us. Are you relaxed?
Yes.
Are you sure? Oh, well, we got a little one there. Okay. There
There.
we go. Okay. And then
Try it one more
last-
time.
Try it one more time. Yeah, be careful that you don't get kicked in the face. Okay, lay back down for a second. That's okay. I'm gonna get my payback right now. Last thing is the Babinski reflex. So you're going to draw a J up the side of the foot and across the sole of the foot. Normal response for an adult is curling of the toes. So draw up the foot and across. So either no response or curling of the toes is normal. An abnormal response is a fanning out of the toes and flexion of the great toe. That would be an abnormal response. So a negative is normal, just like if you get an x-ray and it's negative, that's normal. So negative is the curling of the toes, okay, like that. A positive Babinski is bad, and that's the fanning and flexing of the toes. Okay, I think that we are done with our neurological assessment.